Hello, this is Cameron Sabet from Cutting to the Case, and today we're joined by Professor Walter Ricciardi. He's one of Europe's most influential public health leaders. He's professor of hygiene and public health at the Università Cattolica del Sacro Cuore in Rome, director of the World Health Organization Collaborating Center for Health Policy, Governance, and Leadership, former president of the Italian National Institute of Health, former president of the World Federation of Public Health Associations, former president of the European Public Health Association, and has served on the executive board of the World Health Organization representing Italy. During the COVID-19 pandemic, he was scientific advisor to Italy's Minister of Health, and today leads the European Commission's Cancer Mission Board while continuing to shape health policy across Europe. Thank you very much for joining us today.
You're welcome.
Yes. So it is truly an honor and a pleasure. And I think one of the foremost questions that our audience might have is when you walk into a room of ministers or heads of state, what separates the leaders who genuinely improve public health from those who simply manage crises?
I've been lucky in all these years to always meet people that were really interested in the common goods. And it was very independent of their party. So it was a kind of bipartisan attitude. And when you meet such people, and it's a pleasure because essentially you bring your experience, your know-how, and they, of course, have to mediate between this advice you give and the decision they have to take. But in many occasions, up to now, I have found myself in a very positive situation, and I wish all the advisors to ministers and governments to find themselves in the same position.
Absolutely. And during COVID or times of crises, what was the hardest decision you supported that you still think people don't fully understand today?
The lockdown, you may remember we were the first country to be struck by COVID after China. And at that time, I really struggled to convince the prime minister. Was not a problem to convince the minister of health, but was a problem to convince the prime minister to lock down the country. And I remember clearly that day when I bypassed my minister, who was hesitant to propose this kind of solution. And I said, Prime Minister, if you don't lock down the country, you are going to have thousands of deaths. And I remember his face blushing and then taking the decision. That was the most difficult moment for me.
Hmm. Yeah, that must have been so challenging. And really, you've spent your whole career doing similar things, moving between science, politics, and global diplomacy. I'm curious, where do you think each of those worlds most fundamentally misunderstands the other two?
Of course, politicians want to win the elections. So they want to convince people, they want to be voted, they want to be loved, they want to be staying in power. While scientists are a little bit the guardian of truth, the guardian of science, the guardian of evidence. And that is the problem sometimes when they have to take decisions that is against their electorate, that is against their popularity, that is against their pleasure to be voted and to be elected. But the good politicians is the one that sometimes, in particular in difficult times, takes the right decision for the common good rather than to appease people for their pleasure.
Yes, it's public interest versus the public's interest. So,
Exactly.
yes, yes. And a lot of these questions in healthcare come down to competing incentives, as I'm sure you've tackled very extensively in your career. If you could eliminate one incentive in modern healthcare tomorrow, and remember, a lot of our audience is actually based here in the United States as well, with a more corporate system. And uh, if you could eliminate one incentive in healthcare tomorrow, what would disappear first?
This is a very difficult question because there are many of them. But currently, in the present times, the so-called commercial determinants of health are becoming very important in determining rather the health, the diseases of people. You may think about, of course, the traditional dangers of tobacco and alcohol, but that's not the same anymore because simply food, nutrition is a danger for millions of people who are overweight or obese. So I would say this is the first incentive that I would eliminate in the current times.
Yes, and this really comes down to, overweight and all these other chronic public health concerns. Europe's health systems are aging alongside their populations too. What's one uncomfortable conversation policymakers keep postponing that eventually becomes unavoidable here?
For instance, taxation of sugar drinks and taxation of tobacco, taxation of alcohol. Of course, this is a difficult question for a politician because they have to compete with vested interest. And of course, this sometimes is a decision that powerful lobby tend to disincentive. So essentially, this is a very difficult question. In some cases, very important person, very important politicians were ousted because they had the courage to do that. So you may think how this powerful lobby can act.
Yes, yes. And you've worked with many, lobbyists and politicians in many different organizations representing different interests, um, ranging from the World Health Organization to the European Commission to national governments. What leadership lesson only became obvious after seeing these institutions from the inside?
That you have always to tell the truth to the power.
Mm,
Okay, so essentially, for a scientist, a scientist who is competent and honest, you will have never to deviate from the truth. Of
mm,
course, you can find compromise. Of course, you can essentially be more open to this kind of not full decisions, but never deviate from the truth. And this is the more important lesson that I would advise to a young person who is starting his or her career in advising politics.
absolutely. And a lot of these questions of speaking truth to power come back to human psychology. Have you ever watched a brilliant scientific or public health idea fail simply because of human psychology rather than bad evidence?
Yes, many times, and in particular because, as I said, politicians sometimes are afraid to take difficult decisions that are against the willingness or the pleasure of their voters. And many times decisions have been postponed, and many times decisions have been never taken because of this reason. So sometimes you have to understand that it's not possible to take that decision, at least for a certain moment, but you have to wait for the right occasion to do that.
Yes, yes. And that also that question of human psychology goes into questions of denial, as I'm sure you approached um, quite significantly in the COVID pandemic. How do you recognize the difference between healthy skepticism and a dangerous denial during a public health crisis?
You may recognize it because essentially people tend to postpone and to deny when some truth is inconvenient for them. So you have to explain with plain words to the general population. Sometimes you have to explain with plain words also to politicians because, of course, never politicians are so competent in any scientific matter. So sometimes, as you said, Cameron, you must be a kind of a psychologist in order to understand when is the right moment. But when I said that I was very tough with the prime minister on March, that month of the starting of the pandemic, there was absolutely no possibility to delay the decision. So I was sorry, but that was the time for me to be very tough on incentivizing the prime minister to take the lockdown decision.
Yes, yes. And in that same vein, what separates the institutions that survive political change from those that are reinvented every election cycle?
In my experience, politicians who ignore science have a bad destiny. You know, sooner or later they are in trouble because the truth is tough and comes sooner or later. And so they have denied, they have postponed, so they find themselves in deep troubles. And at that time, the electorate and the voters understand that essentially they were not led by the right person. So the long career of many important politicians is also because they asked questions, asked advice to the right people in the right time.
Hmm. Hmm. And they ask questions to the right people. If you had one uninterrupted hour with every head of government in Europe, what single message would you leave them with?
Climate change. I mean, I'm working on that with colleagues around the world since 10 years. And there are climate scientists who are telling this inconvenient truth from 50 years. And we have lost all these decades not taking the right decisions. Now, of course, it's evident that climate change is becoming a real problem. Everybody understands that this extreme heat and essentially the problems that we are having with fires, with extreme events are evidence. But for many years, both, I must say, politicians and the general population have denied the problem. So this is the most single threat that we have.
And potentially the problem is still quite rampant here in America, just having people accept there's much more of an independent culture here in America where people are like, I don't want anyone regulating me. What are you talking? Stay off my lawn. I am here to do things independently. What would you say for public health leaders here in America, maybe looking to Europe as a blueprint for how to get people on board with science?
They have to explain in a very plain words what's happening. And of course, understanding the fears and the problems that some people can have, not demonizing them, but trying to share their point of view and to explain with plain words what the truth is. And explain that now we are in serious danger. And the problem is that for not for the next generation, is already here. And so showing the result of this denial, of this waiting times, which is useless to act, is possible to do, and I encourage them to do.
How do you have, um, I guess, a population that cannot see beyond kind of a myopic distance of their own self-interests, where they focus on independence over long-term collective well-being of at a population level? Because this is the fundamental difference in cultures between, Europe and Asia with a more collectivist attitude toward change and America. It becomes very challenging for public health. If Anthony Fauci is on faculty at our Georgetown School of Medicine, he's given many talks about this. And I'm curious what an international public health leader would have to say specifically to the questions of, well, what if the public just doesn't care about the long term, even if it's explained to them clearly?
You have to insist. You never have to give up. I mean, it's understandable. But for instance, for climate change, it's becoming evident that every single person in the planet is going to be affected. And it's evident. I mean, while we speak, there are hundreds of thousands of people in Spain and France which are displaced by fires, never happened before.
Mhm.
So there are entire villages, entire cities that are emptied because of this. So now they understand that we have a problem. So you have to explain everybody that the problem is for everybody on the planet. So they are not exempt of these dangers. And sooner or later, they will be protagonists in the bad sense of the word of this. So why don't we act now that we have the evidence, the science, and the technology to avoid major problems?
Yes. Now, for someone living in Texas, for instance, far away from the coasts, or someone living in any of these US states, a lot of the places first impacted by climate change might be, these coasts in Europe or Fiji islands in the South Pacific, that get completely swept away. And Americans with their heavy air conditioning, we don't not use air conditioning like in Europe. We use air conditioning extensively everywhere, and it just becomes a place where the population is detached and is apathetic, even when presented with the evidence that it's currently ruining the world. They are far enough distanced away from it. How do you bring that to their doorstep, even when they're completely apathetic and shut out?
That's very difficult. I mean, of course, you have to understand that every human phenomenon has a kind of normal distribution. So like 20% are the early movers, 20% are the late responders, and 60% depend on where they go according to the effort you do, to the word, to the word you speak, and to the message you give. Sometimes can be very difficult, sometimes can even be impossible. And so you have to understand that in some situation, given the fact that they are trying to no respond at all, it's very difficult to convince. And that's a human factor that you have to take into account.
Yes, yes. And really you've advised governments during moments when millions of lives were at stake. I'm curious, how do you personally make decisions when there's no perfect answer and every option carries such significant consequences?
Having two polar stars. One is the evidence. Of course, when you have a new virus, you don't have yet the evidence available. So you have to gain the evidence every day. But according to the evidence you gain every day, you can advise decisions. And the second polar stars is the interest of citizens. So never take a decision that is against the interest and the good of citizens. So when you advise having the scientific evidence and the interest of citizens as a polar stars, you are always right.
Hmm. And many people believe that better evidence automatically leads to better policy. After decades in both worlds, how true is that reality, and how do you inch the evidence closer to affecting change?
No, it takes times to convince decision makers that the right evidence is already there. They have to take decisions. I mean, that would be the most important innovation to apply the evidence that we already have. I mean, it would be enough to save the world 10 times, or to solve problems many times. So it's difficult, it's not easy. Sometimes the evidence is there, but is not taken into account.
Mm,
And responsibility or the ability of an advisor is trying to convince politicians that the evidence is there, they have to take it, but it's not always possible. And of course, sometimes you can even, as in my case, resign from your post because politicians deny the truth. When I
mm,
was president of the Italian National Institute of Health, I had to resign because the government at that time was anti-scientific, So they denied the truth. They denied the importance of vaccination.
mm.
They deny the importance of public health measures. So when there is this kind of situation, you have gracefully resign, but never deviate from the truth, never deviate from the interest of citizens.
And thank you for never deviating. This is incredibly important work. The world needs more people like you. If you were to wind back your career, 25 years old, 20 years old, starting your career today, what problem in global health would you devote your entire life to solving, and why that one specifically?
We are at a different times. I mean, public health was very successful in the past 200 years. Think about life expectation, quality of life everywhere in the world. The results that we have been astonishing. But now it's a different problem because now, after the pandemic, rather than increasing the importance of evidence and science into decision making, this has been decreasing. So we have the risk of having a regression of health. So
Hmm.
rather than having less disease, more disease, rather than having increasing of life expectancy, increasing of mortality. So it's a challenge, and the challenge can be won only with courage. So I would say that now young professionals, in comparison with the past, must have more courage than in the past, because in the past was naturally accepted that science was a very important asset. Now is not automatic anymore. So being a scientist, being a professional, being a doctor, being an intellectual in current times is more difficult and needs an additional virtue, which is courage. Courage is as Churchill said, is the most important virtue, becomes first. And you must have courage nowadays.
Especially when the white coat is no longer the final authority in medicine anymore. It's the social media influencer, or whoever people find online. Um, and what would you say to doctors trying to, people on the ground who are not the global health superstars that you are, who have led entire nations, that are going by in community health and trying to enact change in their local communities? What steps would you suggest they take?
I would say you are an incredibly good professional from a clinical point of view, but don't forget that you have another very important soft power, which is the power of your leadership, the power of your authority. I mean, doctors are trusted people by people. So never underestimate that the words you say to your patient is very important for their lives. And if you are able to tell the truth and to tell that in the appropriate way, you are one of the most powerful actor of change, or at least of life quality in your environment. So don't underestimate, use it. In my opinion, every doctor is a leader, and every doctor should use his lead or her leadership in order to do the best for their patient, not only from the clinical point of view, but also from the health point of view.
Hmm. Hmm. And This is truly a historic time in medicine, as you've rightly pointed out. I'm curious, imagine it's 2045, many years into the future, and historians are writing about this era of medicine. What do you hope they'll say we got right, and what do you worry they'll say we completely missed?
I hope that we say there was a danger, there was a change in human life. I mean, think about the incredible change that we're having with artificial intelligence.
Hmm.
But the people the leaders that took the right decision to regulate artificial intelligence, not to leave uncontrolled, they took the right decision to save the planet from climate change. They used technology they had not for the bad, but for the good. And I'm optimistic that it will happen. Of course, there is an old time that is over and a new time that is now happening. And we are in a transitional phase, and we have the future in our hands. We have to be brave and good in order to shape in the most appropriate way.
Yes, yes. And really in this along these lines of historic events as well, we're obviously seeing the emergence of artificial intelligence in medicine. And I think it's very appropriate to bring this up in the context of these questions of misinformation and across both patients and physicians, where they look to artificial intelligence and outsource their thoughts. I'm curious if you had any thoughts as to how artificial intelligence should be regulated at the national level or international level, or if it should be regulated at all.
We have to find a compromise between the protections of privacy and security and the innovation brought in the health sector by artificial intelligence. And I don't think that the solution is in extreme regulation or total unregulation. You should find a compromise, and this links to active decision by the current regulators. Europe sometimes is too strict in controlling this kind of approach. Maybe United States are too open in going the other direction. I look at as a very interesting experience, the experience of Australia. In my opinion, Australia has found the right compromise in using artificial intelligence while protecting the common good. And I think they provided a very good examples to be followed by democracies. Of course, China is a different story. It's not a proper democracy. But if you want to keep democracy, I think Australia is a very good reference point.
Hmm. And speaking of looking to reference points and blueprints, a lot of the work that I've done in my past research groups is to take existing highly successful healthcare revolutions that have occurred in certain countries and applying their insights into other places. For instance, Rwanda, after the genocide, how they rebuilt their healthcare infrastructure. I'm curious if you had any insights into countries that may have quietly reconfigured their health system and been the silent heroes that have been overlooked by the global community.
One of the most interesting examples come from India.
Hmm.
India, is a huge country with billions of people, and they have a problem. Of course, they have a very low percentage of their GDP allocated to health. They are trying to provide care to their citizens using artificial intelligence in a very open way, providing a very good collaboration between public and private. And essentially, they are doing something incredible. I mean, there is more digital health in India than anywhere in the world. And if at the moment is very much in an Indian affair, but I believe that they are developing a kind of artificial intelligence that is going to be very impactful also around the world because it's an artificial intelligence that in our sector is developed by doctors for doctors, not by informatics or engineers for anybody. And I believe that they are really doing a great job. And in my opinion, we will have a very strong surprise from India.
Wow, that's incredible. And how would you say that India, their healthcare systems revolution, can be applied to maybe rural places in Europe or the Americas?
Yeah, I mean, they were in troubles. They didn't know even how many Indian citizens were, so they didn't have a census. Now they have this kind of information because in every rural area, in every village, there are people going with an iPad and then essentially taking data from the digital point of view and providing services according to. So, in a very rural area of India, the quality of service can be comparable, at least when it's possible, with the care provided in the most important metropolitan areas. And this is already happening. So I believe that the world is going to be having a positive effects of what's happening in India.
Hmm. And also, Italy is extremely close as well, much closer than I am, for instance, in DC, to Africa as well. And I'm curious, I was recently at an African Ambassadors Economic Summit, and they were discussing the recent USAID cuts in Africa and how that's impacted healthcare. And I've written extensively about this at the Lancet and other outlets. One of the concerns that African ambassadors have is how can they wean off support from the United States while still convincing their leaders to invest into African healthcare infrastructure. Now, bringing these insights from your leadership in Italy and the understanding of how Italy or India helped their healthcare, how can you, what advice would you give to maybe leaders in Africa looking to wean themselves off of foreign aid and become independent?
I understand their troubles because they are in real troubles. Everywhere in the world, they have been affected mostly by US aid cuts, and they are really suffering for this. And in the meeting we had in Berlin a year ago, the World Health Summit, I met many of them. So I found them very motivated, but still in trouble. So I don't have a proper advice for them at the moment. So I encourage them to be strong, to go in the right directions. But at the moment, I don't see, because there are no other countries that want to invest the same amount of money that US gave in the past. Not China, not Europe. So essentially, it's a problem from a financial point of view. But essentially, what I believe is going to be important is don't let them down, don't let them alone, and trying to continue this kind of collaboration independently of the funding we have.
Well, you did mention China. China has been kind of doing some investments, but with some strings attached in that they want to maintain some control. Would you
Exactly.
recommend that they take China up on that, or would that be a step too far?
China, as you said, I mean, China is investing only when they have a proper and sometimes a quick return on investment. They are not, they are very interested in their own business rather than in developing international affair. So it's not the same approach that USA had in the past, which was a beacon for progress and development around the world. So at the moment, the European Union is the large donor in that domain. But essentially, you know, European Union is having trouble. We are having trouble ourselves in to find a new balance. So it's not exactly in the same position that US were in the past. So I believe that the next immediate times are going to be tough for everybody.
Very difficult, yes. And uh, a question about India specifically as well. I mean, speaking about rural, kind of lower income regions. What has your experience been with the verbal autopsy model? Being that you go through and for public health, you essentially, you know this, but I'm just explaining it for the audience. Instead of doing a proper autopsy where the healthcare infrastructure may not be available to do, they knock on doors and identify what someone might have died from, be it tuberculosis or whatever it may be, and they log that in. So there can be traveling health officials who go around villages that might otherwise not have autopsy resources. Has this been a success? I know it's been a wild success in India, but has this been a success in other regions, and can it be applied to like rural areas in Europe or America?
I think it's a good solution when you don't have enough resources. Of course, you are obliged. I mean, in good situation, you can do the ordinary kind of autopsy. When you don't have the kind of resources, in some cases, is the only alternative you had, and the objectives in sometimes are reached in this way.
Hmm. Yes. Are there any other unique or innovative approaches that you'd like to share with public health officials worldwide that that might not have been thought of before.
No, one message that I would like to give to young professionals is that, you in the past you always heard, I mean, the doctors is going never to be substituted by artificial intelligence. There will always be a human being behind it. There is a risk that this is not true. Of course, we hope that the medicine is always be based on human actors playing their roles. But if you don't have enough doctors, if you have large and increasing needs, if you have rural population abandon themselves with no services,
Mhm.
artificial intelligence is going to take the place. So we have to be active players in this, not passive players. We have to shape the way in which we provide medicine. So artificial intelligence is not an option. It's something here to stay, and we have to be protagonists in using it, not to be used by artificial intelligence.
Thank you very much. And do you have a final comment or word of advice for members of the early career medical community worldwide?
That independently on the choice you make, I mean, you want to be a clinician, you want to be a public health doctor, you want to be an entrepreneur, you want to be a digital health expert, please have in mind that the two polar stars for our actions in the world are scientific evidence and the common good and the interest of our patients. So sometimes, particularly the professional look for money, look for power, look for important and prestigious positions. Of course, being ambitious is a very good thing, but that's not the most important thing. The most important thing is to be a leader for yourself, a leader for your patients, a leader for the world.
Thank you for the reminder that this is all for the humans at the end of the day and not just for self self gratification or the ego, be it. Thank you very much. I very much appreciate this conversation. Thank you for joining Cutting to the Case today.
Thank you. My pleasure.
Yes, wonderful. So this is Cameron Sabet, and this has been our latest episode of Cutting to the Case, and we are signing off. Thank you very much.